Hi, I'm Catherine deVries. I'm professor of surgery and working in the global surgery at the University of Utah. But I am actually a pediatric urologist. Pediatric urologist doing global surgery. What does that have to do with big work? Well, there's a great need for pediatric surgery in general and pediatric urology specifically. As I've been working around the world for the last 25 years, though, I've seen that there are a lot of bigger problems than just pediatric surgery. And one of those is facilities. Facilities lack electricity, they lack infrastructure, and the system accountability in many countries is really lacking. I've become over the time a systems person and not just a technical person. As we've started looking at what the system of surgery looks like, we've come to think about it as an ecosystem that includes the community and the hospital system. The community is not trivial. The community's approaches to how we think about surgery, what contributes to health and healing, whether things like stomas are acceptable, is directly bearing on how we're able to engage the surgical system. But when we think about the surgical system, it's not just the people, it's the hospitals, and it's the systems within the hospitals. We're used to, in the States and in Western countries, getting our supplies just in time, as we do with Amazon, but in other places, these come up on big trucks intermittently, and supply chain is a huge problem. We know from the SDGs that good health is a fundamental principle in global health, global sustainable planetary health, and yet everything we do in global surgery and global health interfaces with other pieces of this puzzle. For example, in a hospital that has a well, the sanitation and the placement of the septic is critically important. And you might see that the septic is just a few feet from the well. Does that matter to us as surgeons? It does, because surgical site infections, which is a big emphasis of Lifebox, has to do with sanitation and how we approach that kind of care. Similarly, how we clean our laundry depends on electricity. It depends on who's available to do it. So these are not small problems. As we think about systems, we have to think about the whole ecosystem, including electricity, communication, water sanitation. All of these pieces of the puzzle are equally important if we're going to do our work in a reproducible and safe way. So we start looking at these lists and we learn from the people who do it best, and those are the nurses. These are the people every day in the operating room. Surgeons come and go, the nurses are there every day. So they have a lot to teach us. They have things to teach us about conflict management, things we don't even know when we're not there all the time. Task conflict, process conflict, relationships, and non-task organizational conflict. Who has priority over what, and how the resources are used? These are things we have paid very little attention to, but we need to pay a lot of. So there are processes for how we do this. There's problem-solving methodology, and we learn this now from the systems engineers, and looking at the root cause of the issues that we're trying to solve and the process for doing it. SMART statements are one way to do that. SMART statements are specific, they're measurable, they're attainable, they're relevant, and they're timed. This is a methodology for actually considering how we solve problems in the operating room as a system and as a team. And this can also be done by process mapping. And this is an example of a map. And I'm not going to go into the details of it, but it's a useful visualizing technique for how we can start solving these individual problems at a programmatic and at a very site-specific level. And we can address things like cleaning hands, something so simple. But how do we measure that we're successful in changing and addressing a problem that's common to high-income countries, middle-income countries, and low-income countries? At our university, we've developed an entire course on how we do these things, and at a local level as well as at a national level, we have to start really deconstructing the OR and looking at how we do a systematic approach to addressing all of these macro and micro problems.